Our kidneys play a vital role in filtering waste, maintaining fluid balance, and keeping our blood clean. To assess how well they're working, healthcare professionals rely on key laboratory tests known as kidney function tests or renal profiles. Let's look at the main ones and what their results can reveal. The first important value is blood urea nitrogen, or BUN. The normal range is between 7 to 20 milligrams per deciliter. When BUN levels are high, it can indicate kidney damage, dehydration, or a high-protein diet. On the other hand, low BUN levels may suggest malnutrition or a diet low in protein. Next is creatinine, another waste product filtered by the kidneys. Its normal range is 0.6 to 1.2 milligrams per deciliter. Elevated creatinine levels typically point to impaired kidney function or kidney disease, since the kidneys are struggling to remove waste efficiently. Conversely, low creatinine levels might indicate low muscle mass or reduced creatinine production in the body. We also measure urine specific gravity, which reflects how concentrated or diluted the urine is. The expected range is 1.005 to 1.3. Higher value means concentrated urine, which can be seen in dehydration or a condition called CADH, where the body retains too much water. A lower value suggests diluted urine, possibly linked to diabetes insipidus or excessive fluid intake. Lastly, the glomerular filtration rate, or GFR, is one of the most important indicators of kidney function. A normal GFR falls between 90 to 120 milliliters per minute. When it decreases significantly, it can indicate chronic kidney disease, end-stage renal failure, or a natural age-related decline in kidney performance. By monitoring these values regularly, we can detect early signs of kidney dysfunction and take action before serious complications develop. Beyond these core kidney lab values, healthcare professionals often analyze supporting tests to get a clearer picture of kidney health and overall body balance. One of these is the electrolyte panel, which measures key minerals like sodium, potassium, and chloride. These electrolytes are regulated by the kidneys, and even slight imbalances can indicate early kidney issues. For example, high potassium levels, known as hyperkalemia, can occur when the kidneys struggle to excrete excess potassium, a serious condition that may affect heart rhythm. On the other hand, low sodium or hyponatremia may be linked to fluid retention or disorders like CADH. Another helpful marker is albumin, a type of protein normally found in the blood. When albumin appears in urine, a condition called albuminuria, it often signals early kidney damage, particularly in people with diabetes or high blood pressure. Detecting small amounts of albumin early can help prevent progression to chronic kidney disease. We also monitor blood pressure because the kidneys and the cardiovascular system are closely connected. High blood pressure can damage delicate blood vessels in the kidneys, reducing their filtering ability. Likewise, poorly functioning kidneys can lead to fluid retention, which increases blood pressure, creating a harmful cycle if not managed properly. For patients with known kidney issues, doctors may also track uric acid levels. Elevated uric acid can lead to gout or kidney stones, while very low levels might suggest certain metabolic conditions. Lastly, urinalysis remains one of the simplest yet most informative tests. It examines urine color, clarity, pH, and the presence of cells, crystals, or proteins, giving direct insight into how the kidneys are performing their filtration role. By combining all these results, BUN, creatinine, GFR, specific gravity, electrolytes, and urinalysis, healthcare professionals can form a complete picture of renal health. These tests not only diagnose kidney disease but also guide treatment, monitor recovery, and help prevent future complications. The kidneys may be small, but their role is massive, filtering every drop of blood, every minute to keep you balanced, hydrated, and alive. When interpreting kidney lab values, it's important to remember that results don't stand alone. A single abnormal reading doesn't always mean kidney failure. Many factors, such as hydration status, diet, medications, and physical activity that can temporarily influence results. That's why healthcare professionals always interpret these values alongside symptoms, medical history, and other diagnostic findings. For example, a temporary rise in creatinine may occur after intense exercise or eating a protein-rich meal. Similarly, dehydration can raise both BUN and urine-specific gravity, without actual kidney damage. Once fluids are restored, the values often return to normal. However, when levels remain persistently high, it suggests that the kidneys are struggling. To filter waste properly, I gauge possible sign of chronic kidney disease, or CKD. CKD progresses slowly over time and is often silent in the early stages. That's why routine screening is so crucial, especially for individuals with diabetes, hypertension, heart disease, or a family history of kidney problems. Detecting early changes in lab values allows doctors to intervene before irreversible damage occurs. Lifestyle choices also play a powerful role in protecting kidney health. Staying well hydrated, maintaining a balanced diet low in sodium and processed foods, and keeping blood pressure and blood sugar under control are key preventive measures. Avoiding excessive use of painkillers or certain antibiotics, which can stress the kidneys, is equally important. For patients already diagnosed with kidney disease, regular monitoring of GFR trends, electrolytes, and protein levels helps track progression and guide treatment. Doctors may adjust dietary protein, recommend phosphate binders, or prescribe medications to reduce blood pressure and protein loss. In severe cases, when GFR drops below 15 milliliters per minute, dialysis or even kidney transplantation may become necessary to sustain life. These interventions replace the kidneys filtering, function and maintain body balance when the organs can no longer do so effectively. Ultimately, kidney lab values are more than just numbers. They're early, warning signs and vital clues that help detect problems long before symptoms appear. By paying attention to them and making healthy choices, we can protect these remarkable organs that silently keep our bodies in perfect chemical harmony every day.